I'm sure the Prime Minister regrets the fact that 100,000 people have lost their lives. The question is why? Why has the United Kingdom the highest number of deaths in Europe? Why has the United Kingdom a death rate that's higher than almost anywhere in the world? The Prime Minister is going to have to answer that question one day, and he should have the decency to answer it today. A few days ago, the Chief Scientific Officer said, and this was his view, prepared to give it now. The lesson, he said, is you've got to go hard, early and broad if you're going to get on top of this. Waiting and watching simply doesn't work. Does the Prime Minister agree with that?
Mr. Speaker, when you have a new virus, and indeed when you have a new variant of that virus of the kind that we have in this country, when you have dilemmas as hard and as heavy as this government has had to face over the last year, I must tell the right honourable gentleman, there are no easy answers. A perpetual lockdown is no answer, Mr. Speaker. But we will continue to do, as I've said to the House, I've said to you, Mr. Speaker, to do everything we can to roll out our vaccine programme, to give the public the protection that they want and deserve. And as I speak to you today, Mr. Speaker, 6.9 million people in our country have had the vaccine. We're on target, if we can get the supplies, to deliver the target of JCVI 1 to 4, the most vulnerable groups, by the 15th of February. And I hope very much to be in the next a few weeks, Mr. Speaker, to be setting out in much more detail how this country can exit now from the pandemic.
Keir Starmer.
Mr. Speaker, the problem with the Prime Minister avoiding the question of why is that vital lessons won't be learned.